until we are all willing to stand up and say enough is enough, then we will continue to live with a healthcare system that I believe is unethical, it is immoral, and I personally believe it should be illegal. As a culture, we have been indoctrinated because we've been told this all of our lives, that we have the greatest healthcare system on earth. Mm-hmm. On earth.
Right? On
earth. We got the greatest healthcare on earth, right? So most of us, first nice day of spring, not here yet. First nice day of spring, we're going to go out and do some yard work. Our back's going to hurt. We're going to go in and see our doctor because we're a member of ZüpMed. We get in that same day, boom, right? And one of us is going to say, yeah, you need to learn to stretch, and you need to build those muscles back up from sitting on the couch all winter watching football games. So you're going to say, yeah, but I should probably get an x-ray. And we'll go, no, really not. Not for routine back pain like this. There's no obvious cause. There's no bad signs. And you're going to say, no, I really want an x-ray. And we can have this conversation, or we're going to go ahead and give you an x-ray because we got to move on here, and we're going to go ahead and x-ray your back, and guess what? There's nothing we're going to see on an x-ray because backs hurt and they get better until they don't, in which case we do some stuff, right? But initially we don't need to do anything. But Americans have been indoctrinated. We've been conditioned to, we have to get an x-ray. And as a result, we x-ray a lot of backs. And guess what? Somebody's got to pay for that. And because we have to pay for those x-rays of backs and MRIs of backs and all of the studies that Americans expect as quality healthcare, our costs are enormous. They're absolutely enormous, and they're unsustainable. I mean, this is just, we're using borrowed money at this point. So you'd expect, if we have all this fabulous quality, that we would be rated very high. Worldwide, mm-hmm. we rank 19th in quality. Mm-hmm. Worldwide, we are 23rd in quality of life. If I remember correctly, there's only 28 or 29 in the entire list. We rank 23rd in the quality of life. And if you live in Memphis, Tennessee, all right, you know that we suffer from infant mortality, maternal mortality, terrible, terrible diseases that really you would expect to find in pre-industrialized countries, right? We are dead last compared with the 6 other major industrialized countries in quality of healthcare. Mm-hmm. So here we go. We're spending all this money. We're convincing ourselves we have the greatest healthcare system in the world, and yet we are dead freaking last. Thank you. I'm done.
Yeah, spoken like someone who has practiced outside of the United States, in which you have. So you do have a unique perspective on that I think we could talk a little bit more about. But I wanted to piggyback off of what you said, quality of life, because most traditional insurance-based programs don't have time to address quality of life. They are either it's mostly reactive medicine, just like you mentioned. You go in for back pain, you get an x-ray, you get sent home. Does your person follow up with you a week later to see if your back pain has improved? Mm-hmm. Probably not. And so that's an advantage of having a membership-based model where your provider calls and checks on you, and we follow up quickly.
It is, and I think that's why we're seeing direct primary care. It's why we're seeing concierge practices. It's not for the faint of heart. I should say, because in America we practiced volume medicine. You see 30, 40 patients a day. You bill, gosh, that would probably be somewhere around $10,000 or more per day. You're going to get maybe 40% of that back from the insurance company. And buddy, you better see 30 or 40 patients a day in order to keep the doors open. And so in our particular model, where we do not overbill, we don't bill, in fact, at all. What we do is charge what we think is a fair, transparent fee. It's not for the faint of heart, because you've got to keep your quality up in order for people to continue to come to you. And we know there are alternatives out there for patients, but at the same time, it motivates us to provide the highest quality of care possible.
Sure. Well, you sometimes get what you pay for.
Ooh, yeah.
So we're dead last.
We are. There's no denying it. And we've been dead last. This is nothing that had happened this year. We've been dead last.
So we're trying to change. We're trying to improve it. But the reality is, if you are a member of ZüpMed, we're asking you to pay for a membership of ZüpMed, where many people are going to also have to have some type of insurance plan that covers hospitalization, or is a high deductible plan where you just budget and pay out of pocket for a membership, which is not perfect. I wonder, you're frugal, much more frugal than me. How do you feel about that?
Thank you for calling me cheap publicly. I think you're right. I mean, this is not perfect. And understand also that with our particular model, concierge DPC aside, the ZUP model allows you to be seen whether you're a member or as a guest. So I think that's a very important distinction, number one, okay, is that you can still avail yourself of a lot of our services without being a member. But I heard one of my favorite people on earth the other night speak, Jason Isbell. He was talking about making change in the way that people treated others. And he said something that echoed what I've been saying for a long time. And I'm sure he's been listening to me, and that's probably where he got it, because he gets a lot of his ideas from me. But Jason said, Mr. Isbell said that until we are all willing to stand up and say, this is wrong, it has to change, then it will never change. And as long as we allow ourselves to be herded down the road as sheep, my words.
Of our dead last.
As long as we are satisfied with that, with working families being bankrupted by the current medical system, as long as we are satisfied with people receiving inadequate care,
volume care that reduces
reduces the quality and provides them with things that they do not need, until we are all willing to stand up and say enough is enough, then we will continue to live with a healthcare system that I believe is unethical, it is immoral, and I personally believe it should be illegal. And until we all stand up and are willing to change that, it will continue.
Yeah, I mean, I know that you have that opinion. I think insurance is necessary. Is it always right? Absolutely not. Does it serve all patients well? Absolutely not. But we're living in a world where we can't live without it. And
well, that's because we don't have an alternative system.
Right.
And you mentioned I did work, and I worked in London. And I can tell you that a national health service is not perfect, nor is the German system perfect, nor is the Japanese system perfect. But they're a lot better than what we've got. And there's nobody going bankrupt over there because they broke a leg. Yeah. Shame on us.
Yeah.